aim is to provide great care for people when they are in urgent need, day or night. Many of our acute services are already high quality, but our arrangements need to be clearer, more joined up and more consistent. We are working hard to achieve this. While we aren't there yet, our vision is to provide care around the clock, 7 days a week to any person in need. We do currently have a range of excellent acute services that work in the daytime and at night. In 2016, we hope to be commissioned for 24/7 services. To access the acute care pathway, you will have one of two types of assessment. You might have a mental health assessment, which is done to build up an accurate picture of your needs, including your mental health symptoms and experiences, your feelings, thoughts and actions, and your physical health and well-being. Or you will receive a formal assessment under the Mental Health Act. The Mental Health Act is the law which sets out when you can be admitted, detained and treated in hospital against your wishes. Sometimes people refer to it as being sectioned. We currently have 5 core teams that undertake assessments to determine whether someone needs acute mental health care. Crisis Resolution and Home Treatment Teams, also known as CRHTTs, who provide urgent assessment to people in crisis and agree a plan with them. Night Nurse Practitioners, or NNPs, who provide out-of-hours assessments when CRHTTs finish for the day. Liaison Psychiatry Teams, who undertake mental health assessments for people who go to one of the 3 Devon emergency departments in Exeter, Torbay and Barnstaple for help. And the Liaison and Diversion Service, who provide a screening assessment and signposting service in order to support the police when they have concerns about the mental well-being of a person. Mental Health Act assessment teams conduct assessments within the framework of the Mental Health Act. The team is made up of approved mental health practitioners, known as AMHPs, who are warranted by the local authority to undertake this role, and they do this with 2 qualified specialist doctors, known as Section 12 doctors. All of these teams work together to support you when you are acutely unwell. As the teams all do assessments, the way they work together is critical to make sure your care is properly coordinated and avoids duplication. There are 5 main possible outcomes from assessments. You might be discharged and signposted to other services, such as primary care or third sector voluntary organisations like Mind or Rethink. You might be referred to one of our community teams or specialist services, where you might, for example, be allocated a care coordinator or perhaps offered a specialist psychological therapy. If you are still unwell and need some intensive support, this might be offered at your home by one of our Crisis Resolution Home Treatment Teams. We have 6 Crisis Resolution Home Treatment Teams covering Devon and Torbay, so you would be looked after by the team most local to you. If you are assessed as acutely unwell, you will either be informally admitted to a ward or detained on an inpatient ward under the Mental Health Act. The Crisis Resolution Home Treatment Teams are the gatekeepers of all acute inpatient beds, and they will make the final decision as to whether you are admitted or supported at home. We have 9 inpatient wards for adults and older people, and 1 specialist ward for older people with dementia. Unfortunately, sometimes we aren't able to provide people with a bed in their local ward, and if this happens, they might be admitted outside their locality to a bed in another part of Devon. There are times when people have to be admitted even further away to other parts of the country. This happens if there are no beds available here, or if you require something more specialist that we don't provide. We understand that being placed away from home is stressful for you and for your family and carers, so we keep in contact with you all during your stay outside Devon and make arrangements to bring you back to Devon as quickly as possible. Ongoing communication and support is really important to people placed away from home. We are working hard to make this even better. While you're an inpatient, your Crisis Resolution Home Treatment Team will remain involved in your care. They will start to make arrangements for when you are discharged, which might include stepping down to a crisis house or to a step-down bed. These facilities are staffed for people who might need a further period of clinical care before returning home. Your crisis resolution home treatment team will also continue to work with you through a short period of home treatment if it is appropriate to support you in keeping well. We've been working with our staff and people who use our services, their relatives and carers, to develop an improved 24/7 acute care pathway. This will build on what is already working well, have a single point of contact, have sufficient capacity to provide great care whenever it is needed, be delivered in appropriate settings, be simple and easy to understand for people using our services and our staff, be clear about roles and responsibilities, be funded by our commissioners. A 24/7 acute care pathway will build on what already works well as improving on what doesn't. It is another important step in achieving excellence in what we do.